Jean Watson's theory of human caring. Jean was born on June 10, 1940, in Welch, West Virginia. She grew up with a close-knit community and family. She was the youngest of 8 children and was 16 years old when her father passed. Growing up, being able to observe interactions amongst her family at such a young age largely influenced her theory. The passing of her father motivated her to attend nursing school. She then later married Douglas Watson in 1961, moving to Colorado, and had 2 daughters. In 1997, she had lost her left eye in a golfing accident with her grandson. This event allowed her to become the one receiving care, required her to give up control and view care in a different light. In 1997, her husband Douglas committed suicide. This tragedy allowed her to grow and experience a spiritual and mystical journey. She received her RN from the Lewis Gale School of Nursing in Roanoke, Virginia in 1961. She later went on to receive her BSN from the University of Colorado in 1964. She received her MSN as a psychiatric mental health nursing, University of Colorado in 1966. Furthering her education in 1973, she received her PhD in Education Psychology and Counseling from the University of Colorado. She did sabbatical studies from 81 until 1982 in New Zealand, Australia, India, Thailand, and Taiwan. She held several faculty and administrative positions in the School of Nursing in the University of California. She was a distinguished professor of nursing at the University of Colorado. She was the founder of the original Center for Human Caring in Colorado, the founding member of International Association in Human Caring and International Caritas Consortium. She was founder and director of a nonprofit Watson Caring Science Institute, author and co-author of 30 books, and she received several awards. Her philosophical underpinnings of this theory have to do with her upbringing. As indicated, she moved to Colorado, where she continued her nursing education and graduate studies. She earned her bachelor's degree in Boulder and then went off to get her MSN. Through her own experiences and tragedies of losing her eye and her husband to suicide is what she experienced with caring caregivers, and this is what shaped her life's journey. During the time of the 70s, there was a need to understand a deeper introspective approach to the human condition. According to Watson, 2020, a model of caring includes a call for both art and science. It offers a framework that embraces and intersects with art, science, humanities, spirituality, and new dimensions of mind, body, spirit medicine, and nursing evolving openly as central to human phenomena of nursing practice. Her theory involves a holistic approach, and the center of her theory is the idea of being more attentive and aware while providing patient care, allowing for more effective care with deeper connections. Her theory was based on several philosophers, including Abraham Maslow, Carl Rogers, and Pierre de Chardin. In addition, the definition of the concepts of person, health, environment are vague, since they are abstract terms derived from multiple West and Far East philosophical thoughts. Some concepts that are used in the definition of health and need to be briefly explained include self-healing, harmony of mind, body and soul, and conciseness, transcendence. The concept of environment is defined as the internal and external factors affecting a person, which creates the need to answer questions about the existence of the world without considering the human factor. affected by the thoughts of existentialism and humanism, the concept of human being, nature, transcendence, and even that energy-giving source, whether it is referred to as a god, divine power, or similar title, are defined based on human centrality. An evaluation of the current world views shows the need to seek another perspective of nursing. Nickford et al. Continues to suggest that Jean Watson's theory can be compared to mysticism. Mysticism is to reach the truth through intuition, revelation, and alliance, which is an old creed in many cultures and nations. Persian mysticism covers a range of worldwide themes and has the potential to be matched with many human science theories. Most nursing theories borrow their theoretical basis from other disciplines, and many nursing concepts are well conceptualized in Persian mysticism. To see the nursing concept from a celestial, mystical perspective is a new approach which may be able to be used to develop other nursing theories. Jean Watson's theory has a mystical underpinning. The four major concepts in the science of care are health, nursing, environment or society, and human being. Watson was able to build upon the concepts and ideas of the philosophers that influenced her, such as Maslow, Rogers, and Pierre. They were pioneers in creating concepts of transpersonal. Watson defines the idea of transpersonal as an inner subjective human-human relationship in which the person of the nurse affects and is affected by the person of the other. Both are fully present in the moment and feel a union with the other. It is indicated that this theory is greatly influenced by theories of consciousness, existentialism, cognition sciences, quantum physics, interpersonal psychology, Taoism, and feminism. The human caring theory gives much importance to the spiritual rather than the physical dimensions of human beings, and emphasizes the self-transcendence and self-actualization of the nurse in caring experiences. This is what makes this theory different from others that focus on only patients and do not notice spirituality as the preferable aspect. Watson's theory of human caring was developed between 75 and 79. It continues to evolve. Nursing was often grouped with medicine. When she was in school, she wished to separate nursing into independent and professional discipline with its own core and values. Theory was influenced by Watson's experiences of both giving and receiving care. This theory was Watson's initial attempt to bring meaning and focus to nursing as an emergent discipline and distinct health profession with its own unique values, knowledge, and practices, with its own ethic and mission to society. Watson believes caring played a crucial role in curing. Caring contributes to positive patient outcomes. It aids in the healing of the patient and provides a sense of satisfaction and reward for the nurse. Meta-paradigms are viewed as transpersonal experiences that aids patients in healing. Four meta-paradigm concepts in her theory: nursing, health, patient or human being, and environment. Nursing is a human science of persons and human health. Illness experiences that are mediated by professional, personal, scientific, aesthetic, and ethical human care transactions. Health is unity and harmony within the mind, body, and soul. Health is associated with a degree of congruence between the self as perceived and the self as experienced. Patient or human being is a valued person to be cared for, respected, nurtured, understood, and assisted. Environment is nurses have existed in every society, and that a caring attitude is transmitted from generation to generation by the culture of the nursing profession as a unique way of coping with its environment. The concepts of nursing, health, patient, and environment are heavily embedded in Watson's theory of human caring. These concepts can be seen in her 10 Caritas processes. Watson believes nurses and patients can have spiritual and emotional connections which aid in improving the health of both the patient and the nurse. The environment of nursing can often be stressful as well as mentally and physically draining. Maintaining an attitude of compassion and caring helps nurses to avoid feeling overwhelmed and burnt out. Providing a caring and supportive environment correlates to better patient outcomes. The phenomenon and practice of human caring and healing are the essence of nursing practice and foundational to sustaining life itself. Dr. Jean Watson. The 10 Caritas processes. The Caritas processes occur within the interaction between patient and nurse. Watson believes nurses and patients can have spiritual and emotional connections which aid in improving the health of both patient and nurse. Sustaining humanistic, altruistic values by practice of loving kindness, compassion, equanimity with self and others. Being authentically present, enabling faith, hope, belief system, honoring subjective inner life worlds of self, others. Being sensitive to self and others by cultivating own spiritual practices beyond ego self to transpersonal presence, developing and sustaining loving, trusting, caring relationships. Allowing for expression of positive and negative feelings. Authentically listening to another person's story. Creatively problem solving, solution seeking through caring process. Full use of self and artistry of caring, healing practices via use of all ways of knowing, being, doing, becoming. Engaging in transpersonal teaching and learning within context of caring relationship. Staying within others' frame of reference, shift toward coaching model for expanded health and wellness. Creating a healing environment at all levels, subtle environment for energetic, authentic, caring presence. Reverentially assisting with basic needs as sacred acts, touching mind, body, spirit of others, sustaining human dignity. Opening to spiritual mystery unknown allows for miracles. Other concepts and definitions include actual caring occasion, transpersonal, phenomenal field, self, and time. Analysis of the theory continued. Here you can see in the center you have the patient and family. Everything around it is everything that influences those patient and families. In Watson's theory, there is great emphasis on a caring and healing environment, which can be provided for a nurse. The internal and external factors help a person actualize his or her inner power of self-healing. That is considered the environment. The nurse is considered an external factor that can offer assistance and care to a person through the 10 Caritas process, including love, empathy, trust, teaching, learning, experiences. According to Watson, a person has 3 dimensions of mind, body, and soul, and is in fact an embodied soul on its way to becoming. Therefore, the spiritual dimension of a person has a higher value than the human caring theory. A person is a being whose wholeness is valued and deserves respect, assistance, and care. From this perspective, soul is the higher sense of self and is similar to the psychological concept of self-actualization. Watson's existentialistic, humanistic point of view shifts to a mystical one as she points out that a person can expand his or her inner healing power and reach an intuitive, mystic, and even miracle-like experience through caring moments. He is an example of how this theory can be applied to practice. In the early 2010, leaders within the Kaiser Northern California Patient Care Service Division agreed to adopt the caring science as a common shared framework to guide professional nursing practices across the region. And they put forth guiding principles in their care model. The principles included co-create caring, healing, nurturing environments, which includes healing art programs, aromatherapy, healing touch, massage, guided imagery, pet therapy, music, as well as interpersonal dynamics that nurture authentic connections between patient and caregivers. Foster helping, trusting, collaborative relationships, which includes attentiveness to practices that convey loving kindness, compassion, and empathy to generate collaborative inquiry and insight across these relationships. the relationships we hold with ourselves, the relationship we hold with our caregivers, and the relationships we hold with our patients and families. This includes attentiveness to the fullest psychological, emotional, and spiritual needs that influence and affect the clinical, medical, physical diagnosis, with the intent to integrate subjective and objective data to co-create solutions and plans of care that nurture total health and well-being. This model is thought to apply to the caring science principles of caring, healing, compassion, and love to the overall total health environment. In any practice setting, taking on the model of caring for the whole person, mind, body, spirit, will have the most beneficial impact on the wellness of the individual. If a theory is only treating one side of the patient, for example, the disease process, there are many other contributing factors that impact a person. An example might be a person hospitalized secondary to having an uncontrolled diabetes. In the hospital setting, a care team will treat the disease by providing a diabetic diet, maintaining blood sugar levels within a normal range, providing medication, insulin, and education. However, unless that person's mind and spirit is also cared for, many factors will become overlooked, such as perhaps the disease process and the consequences of the disease process has limited a person's mobility, and perhaps that is leading to increased depressive symptoms, which therefore inhibit the person from caring for themselves in such a way that treats all factors of a person's well-being. Having care providers be aware of all sides to a person benefits the patient and promotes improved overall health. The caring theory testability. Watson's work on the theory of human caring has been used in many studies. It has been used in both qualitative and quantitative studies, and its impact is still being examined today. For example, Ozan, Dumat, Sisek, and Baxi in 2020 used it to examine that Watson's theory of human caring and its effect on anxiety. Another example, where 53 students were part of the intervention group and 53 students were part of the control group. They were third-year nursing students. It was a single-blind, randomized controlled study. The intervention group were paid with instructors who used standard guidelines that were in line with the theory of human caring. The instructors had published studies on the theory of human caring, so they were knowledgeable in the field. All application took place during the women's health nursing courses. Anxiety levels were measured using the Spielberger State Trait Anxiety Scale. Key findings include: before the applications of human caring, both groups' anxiety levels were measured, and both groups scored similar scores. In addition, there were no major differences in regards to sex, gender, age, location, or social status in either groups. This is important because it reflects valid results. It demonstrates that one group was not affected more than the other due to differences in the group. The results of the study revealed that experimental group achieved positive results due to the theory of human caring. The experimental group had a much lower level of anxiety post-intervention compared to the non-experimental group. The effects of clinical education program based on Watson's theory of human caring on coping anxiety levels of nursing students are randomized control. Most of the Watson's theory is relatively parsimonious, according to McEwen and Wills. Although a number of new concepts and terms are defined, there are only 10 curative factors or areas to be addressed by nurses. Among the 10 curative factors include sensitive to self and others is a bit complex in her theory. Being sensitive to self and others might block the satisfying relationships. As a nurse, these factors are very important to apply at work. In addition, her theory is very easy to understand. However, the complexity is very unique. Caring is a key point in her theory. Caring reprobate person's spirit and raises our ability. The level of complexity in her theory is integrated by variability of nurses and the care provided by them to the patients. In her view, nursing is practice and it depends on each nurse how they demonstrate care to the patients. Watson's theory mostly connected between nursing and caring. Moreover, her belief in value in extending nursing science mainly focuses on nursing and caring. Nursing is a science of persons and health illness experience that are treated by unique technique, ethical care interactions, as well as professional. She also stated that the science of caring is used in education and practice internationally and in numerous research studies. The science of caring encourages our own inner performance towards completeness of mind, body, and soul. The selected theory is nursing and caring, in which caring is equally valuable experience for both nurses and patients. And it's beneficial for the nurses, patients, and all healthcare teams. A mid-range theory I would like to discuss is empathy, which is one of the examples of middle-range theory. It's mostly focused on Watson nursing and caring theory. For nurses, being empathetic must become united into our everyday practice. The middle-range theory of empathy was developed based on nurse-expressed empathy, patient outcomes, and development of a middle-range theory. Watson's theory about nursing and caring directly related to one's own behavior towards another. Empathy is understanding others' feelings like your own feelings and treating the person accordingly. Merton indicates whose work served to promote the development of middle-range theories, described them as lying between the minor but necessary working hypothesis that evolved in abundance during day-to-day research and the all-inclusive systemic efforts to develop a unified theory. Middle-range theories include more than one idea or belief, as well as designated interconnection between the ideas. Moreover, mid-range theories directed towards experience, which is related to health, environment, nursing, and people. Its concepts usually be like separate, noticeable, as well as sufficient to be related over various settings and used with patients with different problems. Middle-range theory is less theoretical than grand theory. Middle-range theory developed because it was difficult for theorists to apply grand theory in research and practice. Middle-range theory related to the grand theory because it developed from grand theories, which has been produced in the nursing literature. These are our references. Thank you for your time, and this concludes the presentation on Jean Watson.